So Stress Awareness Day, not sure why we were so focused on stress. I was just talking with a colleague, and stress is a normal part of life. But being that it's Stress Awareness Day, I thought I'd go over some of our breathing techniques that we discuss with our clients that allows them to regulate their parasympathetic and sympathetic nervous systems. So I learned how to do deep diaphragmatic breathing literally when I was like 12 years old. Had a teacher in our music class that taught us how to breathe, and I'll show you what those techniques look like. The thing about deep breathing, and shallow breathing for that matter, is that it does help to regulate those parasympathetic and sympathetic nervous systems. So when we're in sympathetic, we're breathing through our chest, and you'll notice most people will be raising their shoulders and inflating their chest, similar to that. And that's a very shallow breathing technique that doesn't get the air deep into the lungs. When we talk about diaphragmatic breathing, it's that muscle that connects the tissues of the lung to that muscle and pulls it down through the stomach, inflating the lung all the way deep into the lobes, which helps to stimulate the parasympathetic nervous system so that we're not in that constant fight or flight situation. So first I'm going to show that breathing technique that I learned laying down, and I'm going to use a book just like my teacher taught me, and you'll notice that when I breathe through my stomach, using my stomach, my diaphragm muscles, that book is going to raise up and down. So you'll notice how that is raising up and down, and I can do that whether I'm breathing through my nose or through my mouth. But it is a lot easier using your nose when you're breathing. Now I'm going to show it as well, sitting up, kind of on my side here. Not as obvious, because my stomach is a little bit distended anyway. But when you're practicing, you can use your hand as a way to identify that that muscle is doing what it needs to do. And again, when we get kind of stressed out, as the term implies, we start breathing much more shallowly through our chest and upper chest rather than lower chest. And you'll notice how my shoulders are even going up as I breathe. And it's a lot harder to get a full deep breath when I'm doing that. So it is somewhat difficult when you're in a moment of high stress and even anxiety to have somebody come and tell you, oh, just start breathing more slowly, right? Take a deep breath. But if you're not trained to use your diaphragm, it doesn't really register. You try to take a deep breath and you're almost straining to get more oxygen in, which in effect actually creates more anxiety for a lot of people. So again, if you can start to train yourself to breathe using your diaphragm, it's going to be a lot easier in those moments to remember to do that and get full oxygen into your lungs and stimulate your parasympathetic nervous system. That's it for today.